our pain discussion is controlling pain through interventional medicine. We would like to thank the authors of this slide deck for their generous approval and allowing us to use it. We received permission in March of 2016. Interventional pain management includes a number of procedures which can help with pain. Many of these are available here on campus in Leavenworth and Topeka, but many need, for many, the veteran needs to be referred to an outside provider. The interventions include cold therapy, trigger point injections, acupuncture therapy, nerve block injections, epidural injections, facet joint injections, spinal cord stimulation, and implantable drug delivery systems. The first one we're going to talk about is cold laser therapy. It's used to treat arthritis, back pain, carpal tunnel, fibromyalgia, knee pain, neck pain, and tendonitis. Cold laser therapy, or low-level laser therapy, is a treatment that utilizes specific wavelengths of light to interact with tissue and is thought to help accelerate the healing process. Cold lasers are handheld devices used by the clinician and are often the size of a flashlight. The laser is placed directly over the injured area for 30 seconds to several minutes, depending upon the size of the area being treated and the dose provided by the cold laser unit. During this time, the non-thermal photons of the light are emitted from the laser, and they pass through the skin's layers or tissue fat under the skin. Patients do not typically get full relief or resolution from their pain symptoms after the first treatment. It takes a series of treatments, usually 8 to 30, depending upon the severity and duration of the condition. Patients often have to return to the doctor for treatment at least 2 to 4 times per week. Old injuries may be aggravated for a few days after treatment, but most patients, this sensation is short-term, lasting only a couple of days. Trigger point injections. Trigger point injections are used to treat muscle spasms, often in the muscles of the upper back and shoulder areas, fibromyalgia, tension headaches, and myofascial pain syndrome. Often there is a palpable nodule in the muscle where the trigger point is located. The area is tender, and frequently, when pushed, pain radiates from the trigger point itself to an area around the trigger point. Trigger points commonly accompany chronic musculoskeletal disorders. The provider locates the trigger point by manually palpation and marks the site. The injection site is then cleaned. The needle is then inserted into the trigger point, and the medication is injected. Acupuncture. Acupuncture is used to treat back pain, headache, fibromyalgia, and osteoarthritis. Here at the VA, we offer at several of our locations a kind of acupuncture called battlefield acupuncture. In this acupuncture, very tiny gold needles are inserted into pressure points in the earlobe. There are 5 in each ear, and this blocks the pain signals to the brain. It can have various effects with people, but it is something that we offer here, and it takes only about 20 minutes for this procedure. If you're interested in battlefield acupuncture, please contact your primary care provider and they can arrange for treatment. Acupuncture involves the insertion of extremely thin needles through your skin at strategic points in the body. A key component of traditional Chinese medicine, acupuncture, is most commonly used to treat pain. Traditional Chinese medicine explains acupuncture as a technique for balancing the flow of energy of life force, known as qi or qi, believed to flow through the pathways, meridians in your body. By inserting needles into specific points along these meridians, acupuncture practitioners believe that your energy flow will be rebalanced. Risks involved with acupuncture are soreness, infection, bleeding, and it may interfere with pacemaker due to mild electrical impulses. Nerve block injections. Nerve block injections can be site-specific. Nerve block is an anesthetic or anti-inflammatory injection targeted toward a certain nerve or group of nerves to treat pain. The purpose of the injection is to turn off a pain signal coming from a specific location in the body or to decrease inflammation in that area. Imaging guidance, such as fluoroscopy or CT, may be used to help the doctor place the needle in exactly the right position so that the patient can receive the maximum benefit from the injection. Delivering a nerve block injection allows a damaged nerve time to heal itself from a state of constant irritation. Nerve blocks can provide diagnostic information to the doctor. By performing a nerve block and then monitoring how the patient responds to the injection, the doctor can often use this information to help determine the cause or source of the pain. Medication delivered by the injection will be placed as close to the nerve causing the pain as possible. It will then shut down the pain receptors within the nerves causing the problem. Imaging can help the doctor place the needle in exactly the right spot. The imaging itself is painless. The effects of the injection are usually immediate. It only takes a short time for the medication to achieve pain relief. However, nerve blocks are only a temporary fix. They typically last for up to 2 to 3 weeks and then wear off as they are absorbed into the body. Some patients undergo several rounds of nerve blocks before they feel more permanent sense of relief. Others may not receive any permanent relief at all from this type of injection and may require different treatment methods to manage their pain or inflammation. Nerve blocks usually take only minutes to administer. You will be positioned on the table or other surface to allow the doctor access to the site to be injected. The doctor will then identify the spot the needle needs to be placed using palpation or imaging guidance. He or she will clean the area with antiseptic solution, and then the needle will be inserted to a depth to deliver the medication as close to the problematic nerves as possible. Epidural injections. Epidural injections are used to control pain caused by the pressure on the nerve of patients with radiculopathy caused by herniated discs, spinal stenosis, and non-specific back pain. The epidural space is the area around the covering called the dura. It contains the spinal fluid and the spinal cord. Corticosteroid is injected into the epidural space to decrease inflammation on the inflamed nerve root. During the epidural steroid injection, a needle and syringe are used to enter the epidural space and deposit small amounts of long-lasting steroids around the inflamed spinal nerve. A fluoroscope is used to visualize the local anatomy during the injection. The epidural steroid injection specifically targets the locally inflamed area and treats it with the maximum amount of steroids, thereby minimizing exposure to the rest of the body to steroids. Risks with epidural injections include bleeding, infection, headache, and numbness. Blood thinners increase the risk of the bleed, a blood blister at the site of the injection. Diabetics need to be aware that steroids have caused hyperglycemia, and the dural puncture itself can cause headache. Side effects of steroids: irritability, nightmares, itching, muscle aches are among others. Facet joint injections. The facet joint is a stabilizing joint. It prevents excessive motion, twisting, and bending in the spinal column. Pain caused by facet joint is worse with sitting or standing for extended periods of time, and is improved by leaning forward. Facet joint injections are a diagnostic tool. The physician numbs a small area of skin with numbing medicine that uses X-ray guidance to direct a very small needle into the joint. He then injects several drops of contrast dye to confirm that the medicine goes into the joint. The dye will appear on the fluoroscope. It's an intraoperative X-ray guidance. A small mixture of numbing medicine, the anesthetic, and anti-inflammatory cortisone is then slowly injected. Radio frequency ablation. The lumbar RFA is a procedure that uses radio waves to stop the lumbar medial branch nerve from transmitting pain signals from the injured facet joint to the brain. The procedure calls for a needle to be inserted through the skin and then guided with X-ray to the correct site overlying the medial branch nerve. You will be given local anesthesia and sedatives, but you will be awake for the procedure. The needle will be directed to its proper location using X-rays. During the procedure, the doctor will ask if you feel tingling sensation or if you feel your muscle twitching. This will ensure that the electrode is in the proper place. Once the needle and the electrode are in the correct position, the nerve is heated with radio waves until that nerve is unable to pass the pain signals to the brain. This can take up to 8 weeks to take effect, usually for 12 to 18 months. It may be repeated if needed. Determination for appropriate RFA candidates requires a set-wise approach, a test run of the procedure, or a failure of several other modalities prior to use. Facet joint injections and ablations have risks, and both procedures are invasive. That is, they enter the skin and into the nervous system or the musculoskeletal system. As with many procedures, your clinician will discuss the potential, if the potential outweighs the possible benefit. Risks include infection, bleeding, nerve injury, or temporary pain increase. Spinal cord stimulation. Spinal cord stimulation is used for failed back syndrome, sciatica, cervical radiculopathy, and complex regional pain syndrome, as well as with peripheral neuropathy. Not certain of the mechanism of action still under study, but improves quality of life in many studies. Each year, more than 20,000 units are implanted at the cost of exceeding $500 million. This works well for failed back surgery syndrome, complex regional pain syndrome, sciatica. 20 years of literature review established the safety and efficacy for these problems. Neurostimulation works by applying an electrical current to the source of the chronic pain. This creates a pleasant sensation that blocks the brain's ability to sense the previously perceived pain. The spinal cord stimulation, soft, thin wires with electrical leads on their tips are placed through a needle into the back near to the spinal column. These leads are placed through a needle inserted in the back. A small incision is then made and a tiny programmable generator is placed in the upper buttock or abdominal under the skin, which emits electrical currents to the spinal column. Trial stimulation is done initially to assess the efficacy of the neurostimulation. For a trial, the only component implanted is the lead. The patient uses the system for 3 to 10 days. The risks include bleeding, infection, pain at the incision site, allergic reaction to the implanted materials, weakness, paralysis, fluid leak from spinal cord, migration of the electrodes, and skin breakdown. The last item we will talk about excuse me. The last item that we will talk about is the implantable drug delivery system. You may be a candidate for an intrathecal, which is in the spinal column, drug delivery system if you meet the following criteria. Conservative therapies have failed. You would not benefit from additional surgery. You are dependent upon pain medication. You do not have psychological problems. You have no medical conditions that would keep you from undergoing implantation. And you are not allergic to any of the drugs used in the pump, and you have a positive response with the trial of the medication. A pump can help lessen spasticity, muscle rigidity, and spasms that make movement of arms and legs difficult, caused by several conditions such as cerebral palsy, which is a nervous disorder that impairs control of body movement, multiple sclerosis, a disorder of the brain and spinal cord caused by damage to the outer layer, which is the myelin sheath of nerve cells, stroke, which is damage to the brain from lack of oxygen due to an interruption in the blood flow supply, other brain injuries, or spinal cord injuries. Spinal analgesia targets the delivery of the drug intrathecally directly into the cerebral spinal fluid in the spinal column. Targeted drug delivery results in low blood levels of the drug, since most of the drug binds to the target or spinal cord pain receptors. A low dose of the drug can be effective, resulting in a low elimination load and reduced systemic effects on the gut and brain. For patients who require particularly large doses of opioids, the systemic effect may become intolerable. Such patients may be candidates for the implantable spinal delivery system that permits intrathecal administration of the opioid, usually morphine. The advantage of this route of administration is the ability to get the opioid directly to the opioid receptors in the spinal cord, thereby reducing the systemic concentration and minimizing side effects. Patients may continue to use oral analgesics on a rescue basis. However, pump technology often permits dosing to be much lower than with oral dosing. Their small size and complete implantation allows the patient a tremendous degree of freedom in daily life. Disadvantages. Risks of the procedure are infection, bleeding, accumulation of fluid causing discharge from the incision, and headache. Risk of medications, overdose. Respiratory depression is of concern when using any opioid for pain therapy. Twitching and muscle spasm, urinary retention, constipation, nausea, and vomiting are common side effects of opioids such as morphine, anxiety and or depression, and edema. That concludes our presentation of interventional pain modalities. The next few slides will show our resources, and feel free to investigate these on your own if you desire. Thank you.